Well, hi everybody. Just to introduce myself, I'm Laura I'm part of the FamFin Homeless Alliance team. Um, we've been really looking forward to hosting this webinar, safeguarding such an important topic for our work, and we're lucky to have two brilliant guest speakers with us today. Um, so, as a bit of a background for why we've chosen this topic, all the incredible work you do as a Vincentian family involves supporting individuals and communities living in vulnerable situations, which unfortunately puts them at an increased risk of experiencing different kinds of harm and abuse. So, when designing projects to address communities' needs, a major thing we're all thinking about is how to keep people safe and how to make our projects a safe place for them. So, we've done a bit of work about this internally at FHA. We've adopted a do no harm approach in some of our processes, and we'll hear a little bit more about what that means shortly. But basically, we thought that hosting a webinar on safeguarding
Básicamente hemos pensado en organizar este webinario
would be a great opportunity to come together to learn about what this looks like in practice and think about safeguarding in light of our work in the Vincentian family. So we've got two guest speakers, so we'll start with them first, and then we'll have plenty of time for some discussions and questions at the end still, hopefully. If you think of questions as you go through, please feel free to write them in the chat, or we can ask them verbally later on. Corinne, we'll go to you first. This is our
right.
first guest speaker. She's a safeguarding consultant from GCPS Consulting, and she's given us at FHA and DePaul International loads of invaluable support on safeguarding. So we're very grateful to have her with us today. Thanks, Corinne.
Super. Thank you. So let me just pop my slides up. Hopefully you can see that, and hopefully you can also hear me. So I'm going to speak for like 15 minutes, and I'm really going to give an introduction to safeguarding and a bit of a kind of top line of, in terms of what we mean by safeguarding, and some of the kind of key concepts or the way in which we might practically apply this. And then I will hand over to Sister Olivia, who's going to talk much more in depth about how her and her organisation have actually done that. So, definition of safeguarding. Within the international sector, there are currently kind of a few slightly different interpretations on safeguarding. But let's just say broadly, what we're talking about is an organizational responsibility to make sure that your staff or your programs or any activities that you do with children and adults in the communities with whom you work, you're making sure that those staff programs and activities do no harm. And essentially, it involves kind of putting in place policies and procedures and measures that help your organization work safely, helps your staff work safely, encourages people to report when things have gone wrong with your organization, and then it helps your organization to respond appropriately. I say that there's a number of interpretations or definitions, I should say. And I think broadly, what we're looking at is safeguarding children or communities from, like, let's say, four different forms of harm. So physical abuse, sexual abuse, emotional abuse, and neglect. What we also increasingly are including in that is trying to ensure that our workplace for any of our staff or our volunteers is also safe. So we want to kind of prevent bullying, harassment, sexual harassment. There is a definition or an interpretation of safeguarding by some organisations as focused as a priority on forms of sexual violence. So that's sexual exploitation, sexual abuse, and sexual harassment. So if you see in the work that you do, the kind of acronym PSEA or PSEAH, that focus for that organisation is preventing and responding to sexual exploitation, abuse and harassment. So it's where you land on this will be according to your organisation and what you feel you need to do. The do no harm principle, I think actually came out or was applied initially to the humanitarian and emergency sector, but it's essentially about organisations and individuals trying to minimise the harm that they may do, either intentionally, it might be, or unintentionally, by the work that they're delivering in the context in which they're delivering it. So do no harm is not just about safeguarding. And when we look at do no harm, we might be looking as well at things about environment or, you know, the kind of economics setup where we happen to be working and making sure that we're not skewing that. But in the safeguarding sense, it's making sure that we do no harm to the people that we come into contact with. The model that you can see on the screen in front of you is a do no harm model. And I'm not going to go into big depth about this, but just to say that what I quite like about this model is that at the top, what you're thinking about always is the context in which you're working and what that looks like. Then you're looking at your organisation and the engagement that it has with the community. So what's your staffing look like? What resources are you bringing? What's the communities who you're working with? And then the dividers and the connectors on either side are exactly the same. And what this means is that the harm that you could cause might be because the principles that you apply around how you work on issues of gender might be different between the organisation and the community, and you might cause harm if you're not sensitive about how you approach that. The power is a big one, and I'll talk a bit more about that in a moment. The values that you bring, and are they chiming? Are they complementary, shall we say, with communities or not? So these, the way that you approach these things can be a divider. They can cause tension and harm within communities, but they can also be the connector. So the way that you approach it will help you understand whether you're going to cause harm or whether you're actually going to have more of a positive impact in the work that you do. I wanted to touch briefly on safeguarding versus protection, because a lot of the time we might use these terms interchangeably. In a way, that doesn't matter, but just to think about what is the priority or the agenda when we talk about safeguarding, and what's the priority or the agenda often when we're talking about protection. And the way that I think about this is in relation to the objective of the two things, and then what you do on prevention, reporting and response. So the objective of safeguarding primarily is to ensure that your organisation does not harm the people you come into contact with. If you were focused on protection, you would be looking as a priority through the work that you do on reducing levels of violence and harm within families and communities. So that the objective of these two initiatives, if you like, is different. When it comes to prevention, safeguarding is about the policies, the program design, the communication work that you do, and making sure that that work is done in such a way that you don't cause harm. If you were doing protection work in a community, you would be looking at how do you do awareness raising, kind of work with at-risk families or individuals needing support so that you could reduce the level of violence that those families or those individuals in the community are experiencing. Reporting under safeguarding, again, primarily you're encouraging reports of harm that you cause as an organisation, but you can also, through your safeguarding reporting, receive reports of harm in the community. But when you're looking at the reports that come through on harm in the community, your avenue is straight away to refer those to formal protection mechanisms such as the police or the health, or however that works in the place that you are working in. Whereas for safeguarding reports, like reports of harm caused by your organisation, some of those might also be referred to services, but this is where you as an organisation might have to do the investigation yourself. So a quick comment on power. It's the imbalance of power, shall we say, or the abuse of power is recognised as, the underlying cause of any abuse that arises. And I suppose the way that we need to think about that in safeguarding terms is that, whatever we do as an organisation or, as an institution, however we work, often we are working with groups of people who might be vulnerable or at risk at any one time. And so organisations, institutions, the individuals that work with those organisations and institutions have an awful lot of power in relation to those vulnerable groups. And if we abuse that power, that is when we end up in a situation where we are abusing the people that we happen to be working with. There's nothing much that you can do to totally balance out that power. I mean, there are things that you can do to try and make it more of a level playing field, but you've got to recognise that there will always be that slight power imbalance, and that needs to be thought through in terms of how you design and deliver your services, your programs, your engagement with the communities. And a good way, one way of thinking about how you might address some of this is thinking about values. And I think this is where what I have seen in particular with working with faith-based organisations is that a lot of really positive work can be done on the back of some of the faith-based principles that you might be working to. So if organisations don't have any values, I would usually recommend that they get some, just simply because hanging safeguarding on those values is much easier ask. So what you're looking at, whether it's an organisational value or a faith-based principle, is about kind of, serving with humility, taking away that power, if you like, respecting the people that you're working with, making a commitment to like poor or marginalized or the people that are vulnerable that you work with, thinking about kind of social justice and excellence. And I selected just 3 faith principles that are used by a few organisations that I've worked with, and I just really like the way that they had framed this for their staff and their volunteers to be thinking about what are we here to do, and how can we counter some of these power imbalances and do the best work that we can do. The safeguarding building blocks, I'm not going to go into huge detail with these, but for those of you that are thinking about, well, what do I need to put in place to make this work? I usually work with this model because I think that it can apply in various iterations to any organisation. So we might work to international standards for safeguarding within our own context. But in the organisation itself, you want a good combination of organisational culture. So that's where your values will come in. You want some reasonable systems and processes in terms of how you might recruit people or how you design your work. And you want your staff and volunteers and the communities that you work with to have more awareness around issues on safeguarding, around abuse of power, and also to be confident to speak up and say when things are going wrong. And I suppose a key element of this, and perhaps something to think about if you're getting started, is to think about what risks does your organisation or your services or your programs present to the people that you're working with. And there's lots of stuff out there that you can draw on to think about that risk. But in simple terms, for the purposes of this webinar, what you're thinking about really is, what do you do? Who are you doing it with? You know, what are the vulnerabilities of the groups? How are you doing it? You know, where is the service or the program? How is the service or program being delivered? And where is it taking place? And it's the combination of those questions and the answers to those questions that will help you determine how much of a risk is our service, is our program, and what do we need to do to try and bring that risk down. And I wanted to kind of end my little section with just giving you like a few, you know, thoughts on that kind of risk profile, if you like. And regardless of what we do, if we're working in certain contexts or in certain situations, there will be what I call high risk factors in those situations. So if you do humanitarian emergencies, that's an obvious one. People are dislocated, they've lost a lot of, you know, like normal services. They might not have access to kind of food or income or anything like that. So that increases vulnerability. But outside of the humanitarian situation, if you're working in contexts where you've got, you know, poor human rights or weak governance or discriminatory frameworks, then that increases the risks that people are going to face, because they don't have anything to fall back on that upholds their rights and their legal standing. And added into that might be issues around kind of low age of sexual consent, which means it's hard to ask, you know, staff and volunteers to conduct themselves in line with some of the organisational policies around children and relationships with children under the age of 18. And then lastly, depending on what your context is, what you then look at is, okay, what are the kind of high risk projects or services that we might be delivering? And these are usually, if I wanted to put these into buckets, if you like, is that you're either delivering these services kind of remotely or through third parties. You know, you might be working with partners that you have not that much control over. Your services or your programs might be around changing social norms or changing legislation for discriminated groups. So that is risky, because what you're trying to do is push against what the kind of the norm or the context is, and that can cause harm within the communities that you're working in. And then I suppose last couple of buckets is around whether you're doing a lot of work that gathers people's personal data. That can be a very risky sort of project, or that you're delivering a kind of care service that has risks with it. So it could be healthcare or shelter. You know, those are risky projects that you would need to think carefully, how do you design and deliver that? So that's all from me. Thanks, Laura.
Thank you so much, Corinne. Thanks for like setting us off with kind of an overview of safeguarding from an organisational perspective. I found the way you sort of talked about power and seeing values through like the dividers and connectors lens quite interesting. I hadn't heard that before. So thank you for getting us started. I'm delighted to introduce our second speaker, Sister Olivia. are you with us and ready to give
Yes,
us your
I'm here.
presentation?
I'm right here.
Brilliant. So Sister Olivia is from the Daughters of Charity. She leads the Safe Child Advocacy project in Ghana, and she's going to talk to us about how her incredible project is addressing issues to safeguarding kind of in the everyday work they do, and a bit about how faith guides these efforts as well. So thank you for being here with us, Sister Olivia. Over to you.
Thank you. Thank you, Laura. Good afternoon, everyone. I want to get
Good afternoon,
okay.
sister.
Okay, so people are hearing me. So
Yes, sister.
thank you, Corinne, for setting the background and the ball rolling. And what a wonderful and very professional takeoff for this conversation. I think mine is simpler, except that it's mouthful because experience is a whole lot. So I'm to share experiences of implementing safeguarding measure in my work situation within this context of this wonderful webinar of understanding safeguarding practices in the Vincentian family. As Laura has beautifully introduced me, I'm Olivia Umoh. I'm a daughter of Charity of St. Vincent de Paul, meaning that I belong to the one of the arms of the Vincentian family. And I'm glad to be here for this conversation. And my outline is quite simple. Introduction, which I've already started, and I will be talking about the context that I work in order to understand the experiences of practicing safeguarding. And then I'll talk about our guiding principles, which is faith is one of them, our best practices, our challenges, which Corinne has already mentioned as risks, and what we have to offer parishioners, practitioners, adding up to what Corinne said, and then conclusion. I'm hoping that I can do that in 25 minutes. So as I am a social worker and I work with Safe Child Advocacy of the Catholic Archdiocese of Kumasi, I am a social service institution that works with children in street situations, women and youth in street and other vulnerable situations. And I also coordinate the anti-trafficking network of consecrated persons against human trafficking in Ghana. So you have all my backgrounds that I'm going to operate from, the Daughters of Charity background, and then the Safe Child Advocacy and the Talita Kum, which is the anti-trafficking background. So, so this is the context that I practice safeguarding, working with children in street situation. If I could just use my camera around, you will see a lot of children around me in our courtyard, working with victims of human trafficking, domestic violence, and doing some training on safeguarding. So children in street situation come into our center on daily basis during working hours to seek help, to use our facilities to rest, to play, to have a safe space where no one would harass them, because ordinarily children in street situation in Kumasi work in the markets, carry load, and do some menial tasks and are exposed to abuses of various types. So abuse is their everyday experience, and coming into our center is actually their safe space. And this is where they meet with adults safe adults, as we call. They can talk with, they can share their experiences and their traumas and their various issues. In my work context too, I'm daily in contact with victims of human trafficking. These are young girls basically who have been trafficked from various countries, including Nigeria, that has the majority of victims that we encounter here in Kumasi and other neighboring countries, and also young girls from Ghana trafficked to other countries who happen to escape or are rescued and return, and then we are here to rehabilitate them, as well as victims of domestic violence, women and young children who are exposed to violence in the family, needing support, needing care. And so Corinne has already laid a background on safeguarding. So I am just assuring that we are on the same page, that all of the systems in place to ensure everyone working in contact with children, young persons, vulnerable adults, knows what constitutes abuse, works to prevent abuse, neglect, and reports any of such they encounter. So this is what I am going to be sharing about, and that broad term describes all the effort made towards well-being and flourishing of the persons that we encounter. Our framework is our theory of change. We can use them interchangeably, that persons in vulnerable conditions, particularly children, are at risk of harm, abuse, exploitation, and neglect where there are inadequate safeguarding measures. So any institution like my own that doesn't have
Institution
adequate
comme la mienne qui ne s'est pas dotée d'un bon panachage de niveau de sécurisation peut être à hauteur de préjudice ou de dommages. Donc, il faut que nos services soient toujours informés par ces valeurs. L'exploitation existe et nos mesures sont là pour lutter contre cette exploitation en sachant que les abus sont nombreux. Et nos services doivent être démarqués par de bonnes mesures robustes de sécurisation afin d'arriver aux conclusions acceptables qui sont notre ambition. Nous devons nuire un minimum, d'abord ne pas nuire, et nous mettons en place des mesures de sécurisation, de sauvegarde pour ce faire. Sinon, nous pouvons faire plus de mal que de bien, comme Corinne l'a tellement bien exposé. Donc maintenant, je vais partager un peu quelles sont nos pratiques de sécurisation. Et je me permets d'espérer que ce que j'apporterai sera utile pour ceux qui sont présents et qui devront contacter les personnes en situation de précarité, de vulnérabilité, en sachant qu'aucun système n'est à 100% parfait. Je suis absolument ouverte à l'idée d'assimiler d'autres mesures et de partager. Je vais parler des filles de la charité de la Saint-Vincent-de-Paul au Nigeria. C'est la province qui nous gère. Et là, la sécurisation remonte aux années 90. Lorsqu'en Afrique, on n'avait pas de notion de sécurisation. Donc, grâce à l'aide internationale de la Saint-Vincent-de-Paul, nous avons pu commencer à mettre en place ces mesures, grâce aussi à l'apport de nos sœurs d'Irlande, avec lesquelles on a eu le privilège de travailler. Donc, on a commencé avec cette politique de base, de guidance, et j'étais parmi ceux et celles qui ont rédigé une politique de sécurisation pour ma province. Et de là, on est parti former des sœurs, des filles de la charité, à un niveau assez poussé. Ensuite, nous avons mis en place une équipe de leadership qui insiste pour que chaque service qui fournit des aides dans le cadre des filles de la charité jouissent de la présence de responsables de la sécurisation. Et pour l'instant, nous sommes toujours en chantier. On essaie d'envisager des politiques de sécurisation qui sont alignées et qui seront très actives plutôt qu'exister seulement sur le papier. Voilà où on est pour l'instant. C'est chose difficile que de faire en sorte que chaque service commence vraiment à mettre en place des mesures pratiques sur le terrain et dans la rue. Voilà l'état actuel d'avancement de nos travaux. Ce que je peux partager maintenant, ce détail de notre service direct avec le service de plaidoyer pour les enfants au Ghana et mon travail avec les responsables et les réseaux de lutte contre la traite des êtres humains. Parce que là, je travaille avec des personnes très vulnérables et je voudrais partager nos pratiques de sécurisation dans cette tourmente. Voici un centre de jour que vous voyez à l'écran. Vous voyez des jeunes femmes qui viennent au centre et qu'est-ce qu'elles recherchent? Elles recherchent du soutien, des parrains, des mentors, une éducation informelle, l'accès à l'éducation et la formation de compétences. Donc, elles viennent parmi nous pour recevoir des bourses ou de l'aide. Et là, elles rencontrent des bénévoles, des employés, des étudiants qui sont bien intentionnés. Je parle, n'est-ce pas, d'un effectif d'environ 30 à 40 employés et qui sont au contact de ces enfants. Toute une gamme de bagages, d'historiques est représentée. Et il y a beaucoup de choses qui se passent entre nous et les enfants dans nos échanges. Et mon équipe descend dans la rue pour rencontrer les enfants de la rue, pour travailler avec eux, les entourer. On appelle ça l'éducation sur les coins de rue. Ici, vous avez également des adultes qui utilisent nos services, mais parfois, il y a des abus, des violences, de l'exploitation, des viols même. Et parfois, il y a des conflits avec les forces de l'ordre. Et là, nous sommes contraints d'intervenir. Intervenir là où les règles manquent et là où la police entre en scène et là, nous devons intervenir. Parce qu'il arrive également que les jeunes personnes aient des difficultés liées à leur travail de service domestique dans les foyers. Alors, nous pouvons héberger chez nous 60 enfants. Et ces enfants sont très vulnérables parce qu'il s'agit avant tout d'enfants qui ont quitté la rue, mais qui n'ont plus de famille ni de foyer. Et nous travaillons pour chercher des familles d'accueil et pour placer les enfants dans des familles qui en seront responsables. Parmi les enfants, on reste des années durant avec nous, 4-5 ans, ils vont à l'école. Il s'agit d'écoles primaires, d'écoles secondaires. Nous avons les enfants dès l'âge de 5 ans et des jeunes femmes de 23 ans aussi. Et ces personnes sont exposées à des risques journalièrement et les abus sont nombreux. Le gouvernement du Ghana a déclaré que des installations résidentielles comme les nôtres sont le dernier recours pour les enfants parce que les autorités savent très bien que même dans ces centres d'hébergement, les enfants peuvent être victimes d'abus parce qu'il faut les nourrir, les habiller leur donner des produits sanitaires, par exemple, d'hygiène, de faire en sorte que les lieux également soient propres. Et parfois, les enfants ne sont pas faciles. Certains d'entre vous, sans doute, qui connaissent les enfants, savez qu'on peut être tenté d'être dur envers les enfants, de parler de manière appuyée pour que les enfants se rendent compte que leurs comportements ne sont pas acceptables. Et les enfants, parfois, vous riez au nez et vous essayez de leur apprendre quelque chose d'important et vous vous sentez sous pression. Donc, nous avons des employés, des sœurs notamment, qui travaillent avec les jeunes gens et tous les jours, c'est difficile. Nous avons également une garderie. Une garderie qui fournit
young children of mothers on the streets. You know, babies, mothers on the street are young mothers who are also abused, and sometimes they get pregnant on the street and they have these babies. They themselves are babies. And so they strap these babies on their backs and they carry load on the heads and they are on the streets sourcing for livelihood. And so our daycare center welcomes these babies to expose them to early childhood education and to keep them safe from the rain, from the scorching sun, while their mothers are struggling on the street. And so this center is also another space that babies, helpless, vulnerable babies are cared for by staff. And you know how that can be very exposing, how that the abuse can breed in such situations. They could be neglect, they could be exploitation, or let's just say I call it abuse and neglect. And so these are all of the spaces that we have to practice safeguarding. And then, of course, with partners, collaborators, and people that we network with. So what do we do? How do we practice the safeguarding? What do we have in place? The best practices are what I'm going to share with you, because that is the way I can put all of them together to manage the time that I have. So what we do, we start with education. And I think Corinne mentioned it very well, so I won't emphasize too much on it. We ensure that everyone who joins our team is well educated on safeguarding, on what constitutes abuse, on what they can do that would be harmful to the children, to the women, to the persons that we serve. We educate the children themselves, the women, the participants themselves, the service users themselves, to know what constitute abuse and how they can be abused, so they can protect themselves, because they need to also be able to protect themselves to a larger extent, especially if they are not babies. So that education for us is key. We do this during orientation. As a new staff joins our team, we take time for orientation, real quality time, and we do a lot on safeguarding, so that individuals will know, because we are from different backgrounds, and some people may not even know that a particular action is abusive or constitute abuse. So we do this with children's service providers and collaborators. For want of time, I would have really loved to talk much about education. And education too, apart from during orientation, we have ongoing education on safeguarding. We do workshops periodically. We do evaluation periodically on safeguarding. At the end of the year, we do evaluation and all of that to see, to checklist how we are doing. We have posters in our various centers to talk about different aspects of to help us to be conscious of safeguarding. We have posters to say that childhood is entitled to special care and assistance. Child rights is our responsibility. Pastoral agents have responsibility to protect children and not to harm them. We talk about corporal punishment is abuse, an aspect of abuse. We have such posters that send the messages and ongoing learning to our team. Then we try to create self-guarding mindset. And of course, this mindset is created through the education I'm already talking about. But we do it in such a way that we sit and reflect with our team about self-guarding. And when issues occur in our services that, sense threats around self-guarding, we sit and we discuss and we seriously analyze the issue and why it is a self-guarding issue. And everybody, is given a responsibility to speak to this kind of issue. And so that people will develop that sense of responsibility and accountability around self-guarding. Because if it is just the director or a few management team that are self-guarding conscious and other people are not, then there is still a self-guarding threat within the institution. And I know very well that even if one person that you don't consider significant in an institution is not self-guarding conscious or does promote self-guarding, you are at risk. The institution would be at risk. Our institution would be at risk even when our gardener or our janitor or our cook, is not self-guarding conscious or does not understand self-guarding or does not promote self-guarding. The whole institution is at risk. And so we try to engage everyone, every damn person who has something to do with the institution. That is about self-guarding mindset. We also try to create self-guarding environments. We try to ensure security measures in place, that the environment is physically safe. We set up standard procedures such as recruitment procedure, grievance procedures, reporting procedures, very simple in a way that our participants, our service users can make use of it and that everyone can understand. We try to build positive relationship because we know that where there is tension, there would be issue around safeguarding. Our service users will suffer. We try to carry out periodic appraisals to sit with individuals to talk about their struggle in terms of safeguarding and other aspects of service delivery, because we know that working with children is quite challenging and that they try your patience, and especially if you are working very closely with them, like the daycare staff, like those who are taking care of them in the residential facilities. There are times that there are really annoying issues and you really have to work on your patience. So all of this the reason why we need to sit together and carry out appraisals. And then we try to create healthy work culture. We try to use checklists, as I said earlier, to see how each unit and individual is doing in terms of safeguarding. We have a quality assurance that we try to put in place of a few people who can sit at the end of a period to give us a feedback around our safeguarding practices. And we try to celebrate those who are actually doing very well and remarkable in their safeguarding practices. And this we do at the end of the year, when we can give awards to staff who excel in their safeguarding practices. And so we also have structures and practices in place, like policy, not policy that is so structured and so technical that no one would understand. Our policy is down to earth. I can share it later if need be. very down to earth. When we are setting up our policy, we sit with every team member and we use the different languages that people understand to develop our safeguarding policy. Very easy and down to earth to practice. And we review this policy regularly. And when we are reviewing this policy, we create small groups to review them, small groups of team members. And not just team members are involved in our policy development. We also engage the beneficiaries, the participants, other stakeholders. We actually sit with the children to look at safeguarding, our safeguarding policy, and the children make contribution, the women make contribution, the victims of human trafficking make contribution, all of the people that we serve. And we also expose ourselves to the knowledge, the knowledge of the state policies and procedures so that we are in line with the practices laid down by the government. And we educate ourselves on the standard operating procedures, our guiding principles. Our guiding principle, the foundational and the most important of our guiding principle is our Christian principle, Jesus's norms. You know, he said, whatever you do to the least of my brothers, you do it to me. And we know that people who are vulnerable are very, you know, are subject to abuse. And so we know that anything we do to them is we are doing it to the Lord himself. We know that they are the people that Jesus himself has chosen to be his brothers and sisters. So we try to share this kind of you know, principle with all our team members. The Vincentian charism is also a guiding principle because St. Vincent de Paul taught us that we shall be judged by our love to the poor, and that the poor are our lords and masters. And this is what we try to share with our team, that we have to treat the vulnerable, the poor, the people we serve as our lords and masters, and that we are called to serve them with compassion, meekness, gentleness, and all of those. And then, of course, the Daughters of Charity province of Nigeria in the last few years ago, developed a value-based approach to service. And that value-based approach to service, you know, emphasizes that there are core values that must be seen in our services, in the way we provide services, that makes us unique as Daughters of Charity, that it is branding the Daughters of Charity service, and that they are this core service, every daughter of charity must adhere to them. And so we have them all written all over our place, the values of compassion, the values of commitment, the values of justice, the value of integrity, the value of collaboration, and all of that. These are the values that inspire us in relation to safeguarding. And of course, the Catholic social teaching is also a big inspiration. In the Catholic social teaching, we emphasize the dignity of the human person, that every human person is born with dignity that cannot be debatable, and it is not subject to how rich or how good or how intelligent the person is. He is born with it. Everyone must be allowed or given that dignity. Option for the poor, solidarity with the human family, the common good, the principle of the dignity of work and care of the environment. All of these principles, if I had all the time to share with you the way we interact with them, these are part of what form our safeguarding attitude, our safeguarding practices, our safeguarding measures, because we take all of this, we have moments that we reflect on each one of these, and they inspire us. Again, the United Nations Conventions on the Rights of the Child is another guiding principle that's, you know, kind of inspire our safeguarding attitude or practices. And we are very emphatic on the 4 welfare principles of non-discrimination, the best interest of the child, the right to survival and development, and the views of the child. That the view of the child is very important when taking decisions around children who have a reasonable level of reasoning. The principle of the best interest of the child is our daily quotes. We talk about it, we discuss it, we use it for our decision making. Whenever we are making decisions, we think, is it in the best interest of the child, or is it in the best interest of our organization, our institution? Are we going for the cheapest? Are we going for the easiest? Or is that what is best for the children or for the women or for the vulnerable persons that we serve? And this is what it guides our safeguarding practices. And then the do no harm principle, which Corinne had talked about basing this conversation on. This principle also guides us in the way we relate to safeguarding and the people we serve, is because we know that potentially our services can have the harmful aspect of it. Sometimes we are overburdened by challenges that we may not be that reflective. And so we keep reminding ourselves of the do no harm principle. This decision, what harm does it constitute? This proposal, this project, this particular intervention, how harmful is it? What is the risk to the well-being, to the flourishing, to the welfare of the child? We encounter challenges, risk, you could call them too. And one of them would be the issue around power, which Corinne earlier talked about. We know we are conscious we have the power over the people we serve, and we can easily abuse this power. That abuse can be exercised at any level by any team member. So if people are left unguided, unsupervised, if people are left without adequate awareness, adequate training, and if people have not learned how to use their powers, there can be a lot of harm in the situation. A simple example would be in terms of food. Maybe we are struggling with the hard economy, and then you are struggling to manage food. So a staff gives a portion of food for 20 children, which is hardly enough for 10 children, because you have that position to make that decision, and it is your duty. The director is not there. Other people and superior officers are not there. So everyone within their power, we try to talk about use of power, because there is a lot of power within the system that people have at their different levels of work. And then the fact that people come from a diversity of backgrounds, into the team. Some people come from a background where they believe that, children must be punished with physical punishments before they can be well trained. And if people come from such background and are in the team, what do? You may do so much training, and sometimes you think they are with you, but behind, they turn around to do their own thing when you are not there, and you are not always there. I know a few times we've had to dismiss staff, we've had to warn volunteers, we've had to ask interns to stop, their internship halfway, because there are those kind of backgrounds that it's so difficult to convince the individual of the principles that you uphold, despite all the orientation. Negative cultural influence, because we in Africa, there are a lot of cultural influences that can distort our safeguarding judgment. And this is not just about lay people, even sisters like me, even daughters of charity, even priests. You know, sometimes when I go to teach or give training on safeguarding, a lot of arguments that come out around certain cultural influences. Poor orientation of new members. There are times that orientation may not be well done because somebody was not on duty, and weak monitoring system, weak enforcement of laws and policies, especially in our states. This would have to do with the government's position, the agencies that are supposed to implement the policies or enforce the implementation of policies and law. Sometimes you even report cases and the cases are not treated seriously, and your victim that you thought you would want to help isn't getting the necessary attention and treatment. Inequality in the dispensation of justice, that sometimes the vulnerable are voiceless and do not get the justice. And these are sometimes the challenges we face, because you are by the side of a person who has been abused and maltreated, and you are struggling to help them get justice and get fair treatment, and it may not always be easy. So I conclude by saying that safeguarding is everyone's responsibility. That is the way we are looking at it for us in my institution. Every damn person is responsible. And unless every damn person is brought to understand and appreciate and own safeguarding and develop a safeguarding mindset, we would be beating about the bush. And then we try to ensure do no harm to anyone that is within our service. We try to be guided by the best interests of the child. We try to encourage people when they recognize or try to recognize abusive situations that violate people's rights, and to report them. And we have a very simple reporting system that should encourage people to report. And we try to emphasize on the right best approach to service, so that people know that the people who come to us for service have a right to good service, to quality service, to decent service, and to dignity of their person, even while they receive the service. That it is not just about charity. We are not doing them favor by the service we provide. After all, if they don't come to us, we won't be relevant, we won't be meaningful, and we won't be living out our roles and responsibility. I have a story around safeguarding, but I think my time is over. But I will just make it very simple, that we change our name because of our safeguarding, principle. We had to change our name from Street Children Project to Safe Child Advocacy. For the first more than 10 years of our services, I think 15, we were known as Street Children Project. But at some point we discovered, or we realized, that the children, the people we serve, were actually being dehumanized by the name we bear. Their dignity were being, affected, and they feel lost anytime that we drive our car to go and see our children in school or wherever. The children feel so bad. And then when we got to know that, we started reflecting around our name, because we wanted to rather empower. We wanted to rather boost the dignity of the people we serve. We wanted to raise them from the low level to, to greatness. We did not want to do harm. We realized our name was actually doing harm to the people we were serving. And so we had to take the journey of changing our name. And our children were so happy the first time we announced our name change, and changed our signpost, and changed our inscription on our car from Street Children Project to Safe Child Advocacy. Thank you very much for your patience. I was not looking at time at some point because I'm sure I have gone way beyond time. Thank you.
Thank you so much, Sister Olivia. That was such an interesting presentation and such an important note to end on with your final story there about the power of language and its ability to do harm or to support. So thank you for sharing that. We'll have some time for a few questions at least. I can see a couple have started to come in to the chat. I'd like to start by asking both Corinne and Sister Olivia, if you were speaking to an organisation that wanted to work on safeguarding, but didn't know where to start, wasn't sure what they should look at first, what's one bit of advice you would give to them?
Who wants? Shall I kick off, Sister Olivia, and then?
Yes, so that I take a breath.
Yes. But please feel free to challenge what I'm about to say is my advice. I think I suppose from my perspective, what you need to have a look at first of all is what is it that you're trying to achieve with your service or your program. And I think that Sister Olivia discussed that really well when she was talking about this is what we're trying to do, and then what are the risks that are associated with that. So before you put a policy together or before you think about putting in kind of like recruitment procedures or whatever, I'd actually start with what do you do in your organisation and what risks might that present to children or adults that receive your service. And then once you've got that picture, you can then decide, okay, what do we need to do to make that service safer? And it could be, as like Sister Olivia talked a lot about, the kind of awareness raising that is done with the staff, and you could just enter into it there. This is what we do as a service, these are the risks, this is what you need to think about as staff when you're working with the children and adults. So for me, that risk assessment around what you do is the important bit.
Yeah, anything I would say would be a repetition, using the African accent to say the same thing, so there's no need for it.
Cool.
Thank you, Corinne.
Thank you both. That was really helpful. Anna and Denise, have we got some questions in the chat? I think I saw one or two.
Yes.
Not sure who got in first. Or Esther, go ahead.
Yes. My question is, as a novice to safeguarding, is there any way one can summarize in some thematic areas? For example, we can say food security, legal security, and the rest of them. Is there any way we can summarize it in that way, so that when somebody picks, you now know what? In fact, this presentation is so beautiful. I was carried away, and secondly, we will pray that we get the materials to also read, so that this information can be used within our environment. It's a beautiful presentation, Olivia, Sister Olivia. Thank you.
Thank you. Yeah, it's Karen, can I go?
Yes, please.
It's a difficult one to wrap, sister. But I would say that for me, it is what makes for the well-being and flourishing of persons that we serve. So whatever it is that does not harm them, that does not humiliate them. We serve people, we dispense service, but sometimes we don't wear the shoe of the people we serve. That's empathy. And so we expect them to be grateful for what we are doing for them. And when they are not grateful, we can lash, we can humiliate, we can add more pain to the pains that go. So whatever way we can handle people, relate with people we serve, that will rather lift them up. Okay, in my service, in my institution, we say that people who come in contact with us feel better and are actually better about themselves than before they came to us. Does it make sense? Simple. That they feel better and are actually better than before they met us. That's all. Because we can sponsor a child in school up to university, but they don't feel better about themselves because of the humiliations we constantly give to them when we pay their school fees and they don't pass well, or they don't behave well, they don't take our instruction, all of that.
Sister Olivia, we have a question on the chat, and it's come specifically from Liberia. And the question is, how do you address about drug addiction and child abuse? Because in some cultures, it's kind of a ritualistic behavior. So it's not just an accident, but it's only something that's accepted and embedded in the culture. So how do you address and discuss this when that's the case?
Well, I think it might be connected to when even children or minors are in conflict with the law. We would have to let them know that this is not right, but how do we make them know it? We would just have to teach in a way that they can learn from us, in a way that they can. I think we start with loving. We start with bringing them close to us, and we start with making them feel that we really care about them, because that is the only way I understand and I see people responding. And the worst addict and the worst delinquent child would respond to you when they really believe that you care about them, they really believe you love them. So the way you can handle them without making them feel that you hate them, you are reminding them that they are bad, they are wicked, they are useless, the better. That's the way. There is no quick fix about it, and it is not as simple as saying it on the screen. It's beautiful on the screen, but ask me sitting here, what happens with my children in the vocational training center every day when they do real terrible things. But I have learned, the children have really taught me how to be tender, how to be soft, because I've realized that screaming at them, shouting at them only makes them worse and makes them aggressive and makes them resistant. That's my experience, and I really believe it. I don't know, Corinne, what you will say, but this is what I am seeing from the grassroots, from the front line, from the day-to-day encounter with these young people. It's challenging, but we also have to do a lot of work on ourselves, a lot of growing ourselves, a lot of self-awareness. Honestly, you cannot work closely with children in difficult situations if you have not worked on your own, self-awareness, maturity, your own personal development and growth. You cannot go near these children. You will rather harm them so much because you'll be projecting, and anger will not allow you to even be reasonable.
And I think I like the way that you put that. And I was also thinking whilst you were talking about, one of the things that I'm quite keen on with organisations is thinking about the fact that we're on a journey. And I think that journey is like, you could call it like love, as you did, Sister Olivia, in relation to the children. But even with your own staff and the volunteers that you bring in, is that thinking about that we all come from different contexts, we all have our own culture, we all have our kind of behaviors that in our context feel quite normal. And actually, if you're going to change the way that adults and like staff interact with children or interact with adults in the community, you have to take us all on a journey to start thinking about how is it that we are relating, where does that come from, what's our background? And there are, like, organizations do some really brilliant work around kind of power and privilege. Just as Sister Olivia said about we've got to get our own mindsets, but we need to understand that it's going to take us a bit of time to get there as well, because we've got a very fixed idea based on our own background on, you know, well, this is how I conduct myself, this is how I am, this is the power I hold. So it's not an overnight fix to get all of your staff, volunteers, you know, thinking the same way. You're going to have to give them a bit of love, as it were, on the journey so that they can bring their own change.
Thank you both. We've got another question in the chat, so I think we'll do that one last. As I know we're over time, but this has been such an interesting session. Definitely didn't want to cut either of you off. We've got one for Sister Olivia. Says it's clear you've done a lot of incredible work to embed safeguarding. Have you experienced any challenges working with other organisations or departments that aren't as developed as you are in safeguarding practices? And how did you overcome them?
Thank you. Yes, we do. We do have some challenges. We are implementing a project to educate communities in the northern part of Ghana on safeguarding and protection of children and child rights. Because this community, we were looking for an approach towards prevention of children being on the streets and being pushed to human trafficking. And so we identified communities that are very prone to children going to the street, and we wrote a project, and we got the project, and we go to the community. So we can't do it directly because we live in Kumasi, which is like 12 hours to the part of the north of Ghana where we are implementing this project. So we had to work with a third party, like what Corinne said. And so we engage in conversations around child marriage. Oh, Jesus. The first time I engaged in this conversation, I felt like crying because the whole idea was different. And the whole concept, we were on a very different wavelength. And I said, my God, how would we ever get it right between two of us? Because if we are not on the same page, then we can't implement this project and we can't achieve what we want, you know. But gradually we started doing, we started offering regular meetings and discussions, and we would just pick up discussions about, you know, child rights, and we allow it to flow. And gradually, we've worked together for 3 years now. And I must tell you that we are making a very wonderful, remarkable headway. And now they even came to request for us to enter into the next 3 years of the project. They're requesting that we do training for all their staff on safeguarding. If we had offered that training at that time, they wouldn't have taken it. It wouldn't have gone anywhere. But now I think they are ready for it, and they've seen that there are different approaches to relating. So we do have such issues, and we have to find ways. Again, as I said, it still comes back to us, the approach we use to relate with the people we encounter, because people are where they are, and it is to no fault of theirs. And so if we think where we are is where we should all be, then we have to patiently and respectfully find a way of coming together.
Thank you, Sister Olivia. Corinne, is there anything you'd like to add to that, or any
reflections? I thought that was perfect.
It was perfect. Do we have, I reckon we have maybe time for one more. If we don't get to all questions, we'll take a note of them and try to answer afterwards. But let's have one more. Can see who got in first. Patrick has asked a question in the chat about how do you address situations where volunteers are being harsh and sort of not loving with the people that they're supposed to care for. What do you do to address that?
If there are volunteers, Corinne, I'm taking it because it is on a practical level.
Yeah.
And if there are volunteers, it is even a simple matter because volunteers are volunteers. You can always ask them to consider withdrawing their services if there is a serious issue like that. But it is even difficult when they are maybe fellow management staff, or when they are your own sisters, and when they are your superiors, like the fellow priests or sisters and things like that. It's even harder. But so if they are volunteers, they are hard, you can work with volunteers. But in any case, whoever it is, when you bring your own perception or perspective on board, and we just hope that the same negotiation will work. But it can be very frustrating, I must tell you, because sometimes you are in a situation where you are equals in the profession. You are the same in the place. This one is in charge of this, and this one is in charge of this, and this person thinks that this is the way to do it. You must be really tough and harsh and punitive on the children or the service users before you can really make sense. They even look at you as weak. You are too soft. That's why they're taking it for granted. These people take us for granted. They don't even appreciate what they do because you don't hit them. You don't do this. You don't do that. It's very challenging, and sometimes you go to your own private space and you wonder, am I doing it wrongly? But then I always go back to St. Vincent de Paul. I go back to Jesus's example. I go back to the social teachings of the church and to all of those principles that we uphold. And I affirm myself that it is the right thing. So if you don't have influence on them, it is difficult because it pains you that they are treating, the persons you are supposed to restore their dignity the way they are treating them, but you don't have the powers. So whenever there is the opportunity and there is a situation, you make your points and you hope that someday they will get to think differently. There are times we are as helpless as the people we serve, isn't it? I don't know if you've experienced that, but I've experienced something like that, where I feel as helpless as the people I'm supposed to be protecting.
Yeah. It's challenging situations that we're always faced with, isn't it? But thank you for sharing your insights to a few of these questions, both Sister Olivia and Corinne. I'm sorry that we have to leave it here as we started late, and thank you again for your patience and persistence with us, sticking with us through our technical difficulties. If you haven't had a chance to ask your question, we've made a note of it, or if you think of one afterwards, please do send it on. We'll do some follow-up with the webinar anyway to everybody that's come. Of course, a huge thanks goes to Corinne and Sister Olivia today for sharing their insights and expertise with us. It's been a really interesting session. I've learned a lot, and all of your questions and contributions have helped to make it really interesting. So thank you all for that. Thank you also massively to our wonderful interpreters. They've stuck with us with our technical challenges today, and we're very grateful that they gave us their time.